Hello, and welcome to today's Power of Knowing, Women's Heart Health. Understanding comes from knowing. February is American Heart Month, a time when all people can focus on their cardiovascular health, and for women, heart disease is the #1 cause of death. This webinar will discuss the risk factors that women face and the role of prevention and lifestyle changes that can be made to improve heart health. This free webinar series is called The Power of Knowing and was created by AuthoriCare Collective, which empowers people to be active participants in their care journey, enabling them to live on their own terms through personalized support for mind, body, and spirit. To get us started, please welcome our moderator, Risa Hanow. Risa serves as clinical and community educator at AuthoriCare Collective and is also a member of the Cone Health Ethics Committee. She is a licensed clinical social worker. Risa, I turn it over to you.
Thank you, Paul. It is my pleasure to welcome our panelists for today. First, Dr. Tiffany Randolph. Dr. Randolph specializes in non-invasive cardiology and cardiac imaging. She has special interests in prevention, heart disease in women, and caring for patients with chronic heart conditions. Providing high-quality care to each patient is her main goal. And Pat Stromonsky. Pat is a nurse with over 40 years of experience. She is currently the clinical nurse educator in the cardiovascular intensive care unit at Moses Cone Hospital and holds a master's degree in nursing and is also a critical care nurse. Welcome. Thank you for joining us today as our panelists, and welcome to all of our participants. We've had wonderful response to this webinar, and we want to take a moment to learn a little bit about who is joining us today. So on your Zoom screen, you will see a question. This is anonymous, so please feel comfortable to respond and choose all that apply to you. Are you living with heart disease? Are you a caregiver, an advocate, a healthcare professional, a human service professional, a spiritual care guide? And we know that many of those apply to us all at the same time. So thank you for participating. It always is nice to have a sense of who is joining us and being a part of our conversation. So yeah, a lot of people living with heart disease telling us this is an important topic for us to be discussing. Thank you very much. We really have a very equal distribution of those who are both living with heart disease and caregivers and advocates, many healthcare professionals and human service professionals joining us. So thank you for participating and joining with us today. As we begin our conversation, I want to encourage everyone to make use of the Q&A box on their Zoom screen. You can submit a question at any time during our webinar, and we will do our best to answer just as many of those questions as we are able. And to get us started, I think, Dr. Randolph, the best question that we can start with is if you can talk to us about those particular risk factors that women face related to heart health and what the role of prevention is.
Absolutely. So first of all, thank you so much, Risa, for having me here today. And thank you to AuthoriCare. I'm really excited to talk about something that is so important and that's really close to my heart. Well, no pun intended. But I think the first thing that we have to know as women is that this is our problem too, right? So for so long, people have looked at heart disease and heart attacks as a men problem. And the truth is, as Paul stated in the beginning, heart disease is the #1 cause of death in women. But despite that, only about 45% of women actually know that to be true. And so events like this are so important just to make sure that we're all starting with the baseline information that this matters for all of us. The thing about heart disease is that, unfortunately, there are many things that are sort of out of our control, right? So you can't control your family history. If everyone in your family had heart attacks and strokes at a young age, that definitely increases your risk. We can't control our gender. So many times we think about men having heart disease more often than women, and it's not actually that it's more often, it's that they sometimes present at a younger age. So for a man, presenting with a heart attack before age 55 would be considered early. For women, it would be before age 65. And some of that is because at the time of menopause, we start to lose some of those protective benefits against heart disease that we benefit from at a younger age. But over the course of a lifespan, it is absolutely still a risk for women. The other thing that's sort of a gender specific thing that doesn't always get as much discussion is childbirth, right? So there's been a lot of talk in recent years about maternal and fetal deaths, especially in the United States, being much higher than we would expect for a developed country. And about 1 in 3 maternal deaths come from heart disease. And that's something that really doesn't get enough education. Sometimes we think in our 20s and our 30s, when we're having children, that we're invincible, and really less than half of women go into pregnancy in an ideal heart health. So what do I mean by that? Meaning that they're at their optimal body weight going into pregnancy, that they do not have hypertension, they don't have diabetes. All of these things increase risks of death with childbearing. Another thing that we don't have control over is our race. So African Americans are at higher risk for many forms of cardiovascular disease. And a lot of that comes back to the fact that African Americans are much more likely to have hypertension than other races in our country. They're more likely to have what we call resistant hypertension, meaning that they get it at an earlier age and that it takes more medications to control it. There are many systematic reasons why African Americans are more likely to have cardiovascular mortality and problems, but so we can't control our race. So just to recap, family history, can't control that. Age, we can't control that. Gender, we can't control that, or race. Other things, I know it's sounding all doom and gloom, but I will get to the positives, I promise. So where we live, actually, right? So in the Southeast, in the South in general, rates of cardiovascular disease are much higher than they are in some other areas of the country. So the South in general, and then depending on where you live within the city, we know can have a major impact on the likelihood of developing heart disease. And that, for many reasons, is because living a heart healthy lifestyle in many situations is more difficult to do on a limited budget, right? Or if you don't have safe sidewalks to go outside and walk, and don't have money to pay to go to a gym, you have to be a lot more creative about ways to get the exercise and things like that. If there aren't many healthy grocery stores and markets and things like that, and the closest things around you are fast food restaurants, all of these things can make your location a hindrance sometimes to living your healthiest life, but not impossible. And then the last thing that you can't control is you can't control your own history, right? So if you've already had a heart attack, or you've already had a stroke, or any other form of cardiovascular disease, these things increase your risk going forward. But as I promised, there are many things that we can control, right? So the first thing is that we can control what goes into our mouths, right? So diet. Diet is crucial when it comes to living a heart healthy life. So we know that ultimately we want to try and limit things that contribute to buildup of plaque or blockage in our arteries. So that means limiting our fried foods, our fatty foods, red meat, pork, and trying to have our plates look more like a Mediterranean style diet. So what do I mean by that? The majority of your plate should be fruits and vegetables. The proteins that we have should be lean proteins. So if you're going to choose to eat animal products, trying to have chicken and fish be the staples of your diet as opposed to like the pork and red meat that I was talking about before. Honestly, the absolute healthiest thing that we can all do for our diets is to be vegan, right? So if you can be completely plant-based, we know that not only does that help to prevent heart attacks and strokes going forward, but it can actually help to shrink whatever plaque may already be there. So that is one way that we can definitely improve our cardiovascular risk going forward, diet. The second thing is exercise. So we should all be getting at least 150 minutes of exercise each week. That can sound like a daunting number, but it's really not, right? That means over the course of 7 days, you need to have 2.5 hours of exercise. And that can be broken down however you want. It can be going for a 30-minute walk 5 days a week. Or if 30 minutes sounds like too much, then go for a 10-minute walk 3 times a day. Or 15 minutes. Slowly build your endurance so that you can sustain longer periods of exercise. Or maybe you don't have time to do something 5 days a week. Maybe you go for a walk for an hour on Saturday and Sunday and just have to fit in 30 minutes one day during the week. You know, you can be creative. But the important thing is that when we are exercising, that we're doing it in a way that leaves you a little bit breathless, right? So a smell the roses walk doesn't really, it's better than nothing, but it doesn't give us the same type of cardiovascular benefit that you get when you're really trying to get your heart rate up and really exercising in a more moderate to vigorous way. The other thing besides diet and exercise, which to be honest, diet and exercise is the staple of everything. If we can start with that in our youth and continue it on through adulthood, we won't have to talk as much about some of these other things that I'll think of that we can control. So hypertension, I mentioned before, hypertension is a huge problem. It is my personal passion and the reason that I helped to develop the Advanced Hypertension Clinic, because when you look at it, of all the modifiable, meaning all the things that we can change, risk factors, hypertension is the greatest contributor to cardiovascular disease, and we do a terrible job controlling it. So as we age, hypertension becomes much more common. By the time you're in your 60s, at least half of the adult population has hypertension. That's a huge number, right? By the time you're in your 70s, 3/4 of people have high blood pressure. And so some people come to me and they're saying, I don't know why, my parents didn't have it. Well, this is just an unfortunate condition that significantly increases with age. Now, that's even if you do a good job of continuing with diet and exercise, though, a lot of times, not always, but sometimes we can push the development of hypertension off into even older ages. With hypertension, especially if you have high blood pressure, really trying to limit the sodium in your diet can be helpful. When we think about how much salt you want to have in your diet, ideally it should be less than 2,300 to 2,500 milligrams of salt a day, which, to put it in perspective, that's about a teaspoon of salt. If you eat out, that teaspoon of salt and then some has already been added to your food before you even think about picking up a salt shaker, right? So really the best way if possible to try and limit your sodium intake is to cook at home as much as you can. And then again, just diet and exercise really helps with keeping those blood pressures down. But sometimes we do need to take medications. And that's okay, you know, just working with your providers to find the right combination for you to keep your blood pressure under 130/80 is what the majority of us should be aiming for. Another thing that we can control is our cholesterol. I'm going to say it again, diet and exercise are huge factors in that. But then again, medication sometimes we have to use for cholesterol control as well. And I'm sure there might be some questions. We can talk more specifically about medications if people have those questions. We can control our body size, right, to a certain extent. The goal is for our BMI, or our body mass index, to be under 25. And so you can do a simple calculator online. You can plug in your height and your weight and see where you are now. At 30, we consider that to be overweight. At 25, we consider it overweight. At 30, you're considered obese. And at 40, morbidly obese. And so with each of those sort of categorizations, risk of developing heart attacks, strokes, all types of cardiovascular complications increase. Smoking, if you smoke, please stop. I know it can be so hard to do, one of the hardest things ever, but it significantly increases the risk of not only heart disease and strokes, but also really starting to think about peripheral vascular disease. So the arteries that supply blood, especially to the legs, it makes those arteries much more narrow. And so that raises the risk of amputations. It raises the risk of not getting enough blood flow to the legs, where you have pain when you're walking. So really trying everything possible to quit smoking, whether that's meditation, whether that's medications like patches or gum or other sorts of antidepressant type medications, all have been shown, as well as counseling, to help people to be able to quit smoking. Diabetes is another thing that we can help to control, making sure that our blood sugars are at ideal range. And so again, diet and exercise are very helpful with controlling blood sugars. But when that's not helping enough, then again, medications, there's unfortunately a lot of different oral medications that many people are candidates for now. It used to just be sort of insulin and maybe metformin, but there's a lot of other things on the market that are helpful for controlling blood sugars, as well as helping to control weight even now. So it's definitely worth having conversations with your providers about options there. And then one thing we can control that sometimes doesn't get as much conversation when it comes to heart disease as it should is alcohol. So I know during the pandemic, especially, many people's alcohol drinking rates and quantities have increased significantly. And sometimes, specifically to women, I've been really disturbed by some of the marketing that is very much targeting women, right? So little slogans like mommy juice and mommy needs a timeout, and seeing a woman with a martini in a closet, or all the rosé, pink, everything is heavily marketed at women, and not sometimes there's been an increasing acceptance of unhealthy drinking, which can actually raise the risk of heart failure and heart arrhythmias. So really, we should only be having 1 drink or less per day, and no more than 7 per week for women. For men, 2 drinks per day and no more than 14 over the course of a week. And so, there are many things that, I'm not saying it's easy by any means, but there are many things that we can do to help lower our risk of developing heart disease over time.
That was fabulous. Thank you. I mean, we want to be realistic, and we want to do all of the learning that we can. And I appreciate we are receiving questions. And Pat, I want to turn to you, because given everything that Dr. Randolph just told us, as we mentioned, not everything is in our control. And so both from your professional and from your personal experience, can you share about the impact that heart disease can have on someone's life, on your life, on the life of women?
Thank you. I would be happy to. And thank you, Dr. Randolph, for giving me that great introduction of, it's almost like I'm mimicking what you've talked about. So in my 40s, again, I was diagnosed with high blood pressure, high cholesterol, and it really took probably 2 or 3 years to try and get that under control. And getting the blood pressure under control was really the hardest piece. And at that time, even as a nurse, I was in denial of, heart disease can happen to me. My dad had had 2 major heart attacks while he was in his 40s. And I was in denial. I thought I was more afraid of getting breast cancer than I was of having heart disease. And as I started re-educating myself and focusing on taking care of myself, I realized that there were a lot of things that I could do to take control of my health. And so, getting my cholesterol down, managing the blood pressure, keeping my blood sugar within a normal range was really important. I was fortunate in that I didn't smoke. I really didn't drink. I might have 1 or 2 drinks a week. Sometimes I don't have any. So those things were really easy for me to not have to deal with. The hardest part was the diet and exercise. And those are things that I still at times struggle with today, especially since COVID. I personally am an emotional eater, and COVID was very stressful, not only personally, but professionally. And I found that I turned to food, which was not a healthy option. The things that I can't control, I couldn't control who my parents were. I can't control my age. Those things I just had to let go of and not really worry about because I can't do anything about it. But really focusing on taking responsibility for my own health and making sure that I was advocating for myself with my providers. The professional aspect of that has been much more challenging. I have taken care of women who have had massive heart attacks, who said they just thought they had the flu or they thought they pulled a muscle. I've taken care of women who come in what we call cardiogenic shock, which is the severe heart failure, who really didn't understand that they had problems all along. And so women's heart health is really near and dear to my heart, not just personally, but also professionally, because I've taken care of so many women who, I have to wonder if they'd had the information and had the resources to be able to manage their own symptoms and their own risk factors if they would have gotten as sick as they had.
Thank you for sharing your personal experience. And so often we do see that meshing of the personal and the professional. And we have received a number of questions, which I am thrilled about because we want to really answer the questions for those that are with us today. So Dr. Randolph, how safe and or controversial is topical estrogen for postmenopausal women? It seems like there's not agreement about this.
That's a really good question. So the short answer is with estrogen replacement therapy, we recommend trying to use it for as short of a period as possible. So if people have actually already had heart attacks or strokes before, we really recommend not to use any kind of estrogen replacement therapies. But if you're otherwise at low risk and you don't smoke, then we know that there is a slight increased risk of heart attacks with hormone replacement therapy. And so if people's symptoms are at the same time, I understand you have to live, right? You can't get through your day at work if you're breaking out into a sweat all throughout your meeting. So we get that. And so trying to use other treatment options as well. I know sometimes the OBGYNs use some of the antidepressant medications can be really helpful for preventing hot flashes. Also, like black cohosh and other types of natural supplements sometimes have been helpful for some periods, for some people. But if you have to use hormone replacement therapies, then and you're not otherwise at very high risk, then from a cardiology perspective, we typically would say, okay, but try to use it for a short period of time and then try a period off to see if your hot flashes if you sort of pass that phase in life.
Mm-hmm.
And then topical the risks are slightly lower with topical as opposed to oral replacement therapies. So
Okay.
reduction.
So Pat, you dealt with this issue of diet, and we have a number of questions really talking about sodium. And so one, certainly to eat at home is a great recommendation, but I wonder, Pat, if you had any strategies that you could share in terms of if you do eat out, what do you try to focus on to reduce that sodium intake? And just sort of an awareness or anything that you've learned along the way that you can share with us.
So I try really hard to not go to fast food restaurants because to me that's the most challenging to try and limit the sodium. Burgers and fries and hot dogs and pizza and that kind of stuff really have a lot of sodium in them. When I do go out, we try to go to restaurants that do offer more healthy options. I like to get salads, and instead of using salad dressing, I like to do vinegar and oil. Sometimes I'll use lemon juice. I just really try and limit those kinds of condiments that can have a lot of salt in them. I try and order, I will be very honest with you. I do eat steak. I do eat meat. It's something that I try and limit. And when I order it, I ask that they prepare it without any salt. It's fine to add pepper, but don't add the salt, don't add the butter, don't add all the other extra stuff. So there's ways to be able to order your food, and the restaurants have been very accommodating in terms of making sure that they follow our requests.
Mm-hmm. So keeping with that theme of some dietary questions, Dr. Randolph, somebody has asked, I was told by a wellness clinic mainly to eat meats, cheese, non-low-fat foods due to ADHD. This seems counter to most health advice. And sometimes it seems like there's competing, right? Factors.
Yeah, it can be a challenge. I'm thinking they probably were talking about ADHD.
That's what I.
So sometimes with ADHD or other neurological concerns, again, this is not my area of expertise, but I believe there's some data showing that increased oils and fish oil and different types of more fatty foods might help improve the conduction of the nerves and the sort of lessen symptoms. So this is a classic situation, I think, of where, you've changed one thing and it helps in one area, or,
Right.
make challenges in another area. And so what I would say is, especially if you have heart disease, then probably maybe, sort of working with your neurology or your therapy partners to see if there might be heart healthy options of things that they can help to control your symptoms. And then if you don't already have heart disease, but as we all want to do, we want to prevent going forward, if you are doing more of a meat heavy diet, and I say this a lot of times to my patients who want to lose weight, right? And they want to do Atkins type diets. Yeah. There are a lot of benefits to increasing the protein in your diet, as far as it helps you to feel fuller, right? And that lasts longer, so you ultimately can consume fewer calories. In a lot of those diets, they really try to have low carbohydrate intake, which is great for losing weight. But the proteins you choose, try and make them lean proteins, right? So soy, bean-based products. If you're going to do meat, fish, chicken, really, again, trying to limit the red meat. It's not a free license to have fried chicken all the time. It's not a free license to eat steak every night. Pat, I'm 100% with you. I'm not going to be disingenuous and tell you that I don't like a good steak every once in a while. I do, right? But it just can't be an every night type thing. So I think even with whatever diet your provider has prescribed, just trying to make the most heart healthy choices within that. And I wanted to add with what Pat was saying too, there's an app that's free that I love called MyFitnessPal, where you can download it on your phone and you can take any restaurant out there and type in what you want to eat there, and it will tell you about like how much sodium is in the food, how much carbs, all those types of things, so that you can make healthier decisions.
Oh, that's wonderful. That's wonderful. We'll make a note of that and add that to the follow-up email. I think that would be great. So I think you've answered this question. Somebody said, don't we need proteins from lean meats? And it sounds like we can get protein from other sources and have our dietary needs met without specifically having meat.
Absolutely. Yeah.
But if we are going to have meat, somebody is asking if you could talk a little bit more about the shrinking existing plaque. You mentioned, one of those prevention things, and the comment is, I'd rather not eliminate chicken and fish, but yet that's a compelling notion if we can shrink the plaque. So tell us a little bit more about that.
Sure. So there's actually two things that have been shown to reverse the plaque that's already there. One is, like I said, being completely vegan. So unfortunately, if you do have a little bit of animal products, I wish I could tell you that it would shrink the plaque that's there, but that would not be true. It will definitely help to prevent it from progressing, especially if with those dietary changes and exercise, you're checking your cholesterol levels regularly and making sure they're staying in range. It will definitely help prevent progression. Statin medications, cholesterol medicines you may have heard about before, those also help to prevent plaque progression. There are some newer medicines on the market that, so between being vegan and some medicines like Repatha or Praluent, you may have heard about them on TV, they actually do reverse plaque. The problem is they're extraordinarily expensive, as you might not be surprised to hear. And so not everybody is eligible for those medications. So the cheapest way is to be vegan. But if you can't do that, it's not really in the cards for me, at least right today. Even just trying to choose one day a week where you're not going to have any meat, right? Or do a meat fast for a week. All of these things that seem small, they really do add up over time, to whereas we don't need to be on as many medications, hopefully, to help lower our burden or our risk going forward.
So not all or nothing, anything we can do is a benefit.
Exactly.
So Pat, just for clarification, somebody asked, is high blood pressure the same thing as heart disease?
So high blood, I'm going to also ask Dr.
Or it's hypertension.
Hypertension
is high blood pressure?
Yes, hypertension and high blood pressure are the same thing.
Okay.
And high blood pressure can cause over time for you can get heart disease from having high blood pressure. So that's why it's important to manage it.
Right. So, and I realize this doesn't have a perfect answer, but Dr. Randolph, there's a question, again, thinking about sodium and that, sometimes one problem creates a different problem. And so my sodium tends to be low related to medication I take for my mood, and went to a clinic and was literally told to add salt to my diet, but wondered if there was a better way to make sure my sodium is stable. Again, I guess it's that impact that some medications have other side effects.
Yeah, so that is actually kind of tough. So sodium levels, when we check sodium levels in your blood, honestly are more related to fluid than they are the sodium, actually. It's kind of challenging. So eating more salt is not going to fix your low blood sodium level. So when your sodium levels are low, it means either you are what we call volume overloaded. So like people in heart failure have a whole bunch of extra fluid, and that can make their sodium levels low because it's kind of like diluted. Okay. In that situation, eating more salt is the opposite of what you want to do, right? Because it's going to make your body retain more fluid. It's just, that's not the way to go. The other thing it can mean is that you're really dry. So there are some medications that can affect the way your kidneys control salt and fluid, and some mood medications do that. And so the problem there is the way that that medicine is affecting the kidneys, and no matter what it kind of like changes the set point of what sodium level your kidneys are aiming for. And so you just eating more salt is not going to fix that, unfortunately. That's almost never the answer when your sodium is low. So I don't know, it's hard for me to answer just off of a little snippet
Sure.
in the whole situation, but I was a little bit hesitant about.
A theme I'm hearing, though, is, how we be sure that all of our providers know about our entire health picture,
Exactly.
so that we're not only looking at the medication for our mood, if we also know that we have high blood pressure and we have a family history of heart disease, and
Yes.
which I think fits with a question. Somebody is asking, is a PCP or a primary care provider the best professional to care for someone with heart disease, or should we see a specialist? And maybe the question is, how do we know when it's time to make that shift, given all of the different realities?
Yeah, I think that's a really good question. I think it's always, to your point, Risa, really important to keep our PCP in the loop, right? So your primary care doctor is like the quarterback of your care. And yes, you may have a specialist for different aspects, but we always want them to be the quarterback. But that being said, there's so much to cover for any one primary care doc that it's really helpful to have people who have different specialty interests. I think if you have a concern, it's never wrong to ask for even just a consultation, to see if there might be other perspectives on things that we could be doing to be more aggressive, things like that. If you have, let's say, high blood pressure, right, or hypertension, and your primary care doc is controlling it well, then no, I don't necessarily think you need to see a cardiologist for that, right? But if you had a history of heart failure, if your heart has ever been weak, or if you have heart rhythm issues like atrial fibrillation and things like that, I think it's important to at least see a cardiologist one time and then have some conversations with them about what follow-up should look like for you.
Okay. So, Pat, you made mention, particularly during COVID, that it was a terribly stressful time, and we could argue we are still there in many ways. And somebody asked about, often we make bad food choices because we're emotional eaters, and the stresses of life cause us to seek comfort in food. How can we reduce our stress factors? And we know that there's not one answer to that, but maybe if you could share a little bit about, I think you mentioned, and Dr. Randolph, you had mentioned, exercise and meditation, but how do we, if we know we're that emotional eater, and I don't know if, Pat, you define yourself that way, but, how did you guide yourself, not perfectly, but guide yourself towards those better food choices?
The first thing I had to do was actually tell myself that I was the emotional eater, because again, I didn't want to admit that. And, by admitting it, then I was able to think about, okay, what different choices can I make? For myself, when I feel stressed and I feel like I need to go for that chocolate bar or chips or things that I think are going to make me feel better, I've started keeping different snacks in the office. I have a nut mix that I keep on hand. I typically bring at least 1 or 2 pieces of fruit with me to work. And so when I'm starting to feel that, I will substitute what I used to eat with something a little bit more healthy.
Right.
Which has helped. I'm not perfect. I still eat plenty of chocolate. I'm a chocoholic. I will admit that. But just making those, having alternatives has made a big difference. And also, it's been a little bit easier now that we aren't so, during COVID, I was either at home with my family or at the hospital with sick patients. And there wasn't that opportunity to go out and socialize and be with friends and have conversations. And so, for me, being around people, being able to have those conversations, being able to, go outside, have a walk, get some exercise, all of those things together are what have helped me.
Right. Thank you. And I do think, as a social worker, I think about where you started, which was acknowledging it. When we know something about ourselves, we are more able to say, oh, that's what's going on, and then try to develop a plan, as you said, to have, instead of the basket of chips, to have some other things close at hand. And we also know that there's issues of cost and accessibility, and we need to acknowledge those realities also, but trying to do what we can. Dr. Randolph, there's a question about atrial ventricular fibrillations of the heart. How important are they? What do we do about them? I'm sure it's patient specific and can be caused by different things, but in general, you have some feedback about that.
Sure. So, two different issues. So ventricular fibrillation is actually a dangerous heart rhythm that can cause cardiac arrest, right? So when we think of sudden death or cardiac arrest, that is when the bottom chambers of your heart start going very fast and irregular, and it doesn't allow enough blood to get to your brain quickly, and people go down, right? So that's what we're bringing pads out and shocking people for, where we do CPR for. So that is very dangerous. Something that it's really important that we all learn how to do bystander CPR. If you go on the American Heart Association website, you can get trained in 5 minutes. It's so simple to do, right? We took away the breathing aspect of CPR for non-medical professionals, because what we realize is that it is critically important to get started on CPR when someone has a cardiac arrest immediately. And sometimes that hesitancy of not wanting to do mouth to mouth really has increased the risk of deaths. We know that this is especially a problem in, again, the African American population. Rates of out of hospital cardiac arrest and death are much higher than other populations. So again, go on the website where you can do learn CPR. With the short and quick version is push hard and fast, right? So in the center of someone's chest at a rate of about 100 beats per minute, which there's a couple songs you can keep in your mind for what 100 beats in a minute. So Staying Alive by the Bee Gees.
Okay.
I'm not going to, well, you know that. I'm not going to
Want to go ahead and
or
give us a preview?
I Want to Dance with Somebody by Whitney Houston is another one. And then for our younger viewers, what is it? It's Rihanna. There's a Rihanna song. I can't remember it. But anyways, there's options.
Right. That's wonderful. That's a wonderful encouragement for all of us. So you mentioned that hypertension is more common as we get older.
I'm
Why?
sorry, I didn't answer the atrial fibrillation.
Oh, yes.
Totally
Sorry.
different. Sorry to get back.
Yeah.
Atrial fibrillation is very important too, but it's a totally different rhythm. So with atrial fibrillation in the top chambers of our heart, your heart starts beating very fast and irregular, and it sends those signals to the bottom chambers very irregular. Your heartbeat with atrial fibrillation can go up to like 150, 160 beats a minute. It's a challenge because everybody feels AFib differently. Like some people feel it immediately when they go in AFib. Their hearts race, they feel short of breath. Some people, if their heart rates are controlled, meaning if they're under 100 beats per minute at rest, they really don't feel it at all. And some people don't feel it at all no matter what the heart rates are. The trick with that is that atrial fibrillation puts you at risk for strokes. So you can imagine if the top chambers of your heart are beating fast and irregular and just sort of shaking, they're not squeezing well, right? And then that means that blood in those top chambers can pool and it can clot. And those clots can break off and go to your head and cause a stroke. So the most important thing with atrial fibrillation is to make sure that if your provider recommends, that you be on a blood thinner to help prevent stroke. The next important thing after that is talking about getting your heart rate under control, and then possibly different things that we do to get your heart rhythm in control, meaning like cardioversions where we put you to sleep and shock the heart into rhythm, or sometimes we do medications called antiarrhythmics to help keep your heart in rhythm.
Mhm.
And then the last thing that we sometimes do is called an ablation, which is a procedure where we go into the heart with a catheter, kind of like if we were doing a heart catheterization, like where we put stents in arteries. But what they do is actually burn the inside of the heart where the rhythm is coming from to help prevent it from coming back.
Great. No, thank you for clarifying the difference between the two and going back. So two questions that are somewhat related. One is, you had mentioned that blood pressure is more common as we get older, and why is that? And if we are taking medication for blood pressure, a beta blocker, some other medication, is there a particular time of the day that is better to take it? Some people say better to take it at night because that's when most heart attacks happen. Is there a time preference?
Good questions. You got a smart audience.
I'll tell you, they are just coming in. They're just coming in.
Okay, so why blood pressure increases with age? One, yes, you're right. Your arteries do get stiffer. So that does contribute to blood pressure raising. The other thing is that most people tend to be less physically active with age, right? Weights tend to go up with age. All of these things contribute as well. And some of it is just, honestly, we don't know, but we can see it tends to happen. As far as the best time of day to take your medicine. So the most important thing is to be consistent, right? So you don't want to take your meds at 9 a.m. today and then noon tomorrow and then 9 p.m. the next day, because all of these meds last in your bloodstream various amount of times, but most of them are either roughly 24 hours, roughly 12 hours, roughly 8 hours, right? So if your doctor has written a medicine to take once a day and you take it at 9 a.m. and today, and then not until 3 p.m. tomorrow, you've had like 6 hours where you had no coverage, right?
Right.
And then your blood pressure kind of does a roller coaster thing. It's also important to track your blood pressure, especially when you start a new medicine. I ask my patients to take their blood pressures twice a day and write it down, because there's a lot of, I love data, number one,
Yeah.
but there's a lot of power in it being able to see like, oh, okay, on average in the morning, my blood pressures are 120. So when I check in the evening, it's 140. So then, you take that back to your provider and we have data to help you answer the question you're asking about, right?
So take our medication at the same time, but also take our blood pressure at the same time.
Mm-hmm. If you do that and you have that data, then we can make really informed decisions about what's the best time of day for you, or maybe we need to, have you do one in the morning, one in the evening. But you're right, there have been some studies that showed that taking your blood pressure medications at night was most effective. It just depends though, because like if we give you a diuretic, a fluid pill, you don't want to take that at night.
Right, because you'll be up all night going to the bathroom, right? Yes.
Exactly. Yeah.
Right. Again, it's that reality of everything impacts something else. So somebody has asked that they had an upper abdominal screening for a GI issue, and they were noted to have aortic arteriosclerosis. Anything I can do or should do? It sounds like a follow-up, at least starting with our PCP, and then maybe having some advice for attention to that.
Yes, agreed. So your aorta is the biggest artery in your body, right? So it comes off of your heart and it brings blood down to your legs and the rest of your body. And so we don't worry that so much that the plaque there is going to cause an obstruction or a blockage in that area, but it does tell us that you've probably got plaque in other areas of your body, right? Where arteries are smaller, like the arteries in your heart or the arteries in your legs and so forth. And so it's a sign that you do have some plaque developing and that we need to be much more aggressive about your prevention going forward.
So something good has come from this being found, because now we can do something about it.
Exactly.
So a question is, Pat mentioned ladies having different symptoms they didn't realize were heart issues. What are some other symptoms we may not realize are due to heart issues? I know, Pat, you had mentioned that sometimes people wind up so far into an illness because they haven't realized the symptoms.
So the patients that I've taken care of, some of them have said, I didn't feel anything at all. Some patients have said, I had a little bit of jaw pain or my neck hurt a little bit. Sometimes it's, just some back pain. They think that they've, lifted something the wrong way. And so it's really important especially when you're consistently noticing these symptoms, that you get checked out.
Yeah. Is there anything else, Dr. Randolph, particular?
One thing that I always think is helpful is if you've got something that seems sort of atypical, see what happens if you exert yourself. So if you are feeling like fatigued or nauseous or anything that's sort of vague that you're worried might be your heart, get up and walk around your house, do a couple jumping jacks, go up some steps, anything that's going to make your cardiac output increase, anything that's going to make your heart have to work harder. Because if blockage is what's causing your funny symptoms, it should get significantly worse when you ask your heart to do something. If you're having those symptoms at rest, if you're just sitting there or laying in your bed, and when you get up and move around, it actually gets better, can be a reassuring sign. It's probably not your heart, still something to, bring up to your primary care doctor or maybe even see a cardiologist for, but maybe not something that you need to run to the emergency department about overnight.
Okay. All right. I want to be sensitive. We are getting close to the end of our time and we have a number of questions. Someone is speaking about the desire to try to get their children off to a good start with eating, but they only want hot dogs, pizza, and snacks. That's hard, but I think maybe trying slow changes, introducing some added veggies on that pizza maybe, or green leafy on that hot dog bun or instead of the bun. I know there's no perfect answer for that.
Those are good suggestions, though. I struggle with this too. I have 3 kids. Some things that can be really fun are growing a garden. So it's really inexpensive to get some pots and dirt and throw some seeds in the ground and let them be a part of growing healthier foods. And I found they're more likely and more receptive to them if they help to grow them. And kids love shapes, right? So like if you have a healthy, if you get some of those cookie cutters and cut out healthy sandwiches into like a dinosaur shape, or put the healthy foods. You can look on Pinterest and stuff and see how they like arrange fruit in little animal shapes or Santa Claus face, or just different things to try and make healthy eating fun. And at the end of the day too, I have to tell myself this, like kids are not going to starve themselves. So if you don't have unhealthy options in the house, eventually they'll get hungry enough and they'll eat your grilled chicken.
Okay. There are a few questions that we did not get to. So participants, please know we will have an email that is going out to everyone who registered by Zoom. It will have access to this recording. It will have some links for resources that we made mention of. And if you would like to respond to that email, it comes to me and I will try to circle back with Dr. Randolph or Pat and get an answer. So we can do some follow-up that way. I think it's a wonderful problem to have that we have such interest, but I want to give each of you, starting with Pat, just if there's a takeaway that you want to leave us with. This has been such a rich time together. Pat, what is a closing thought for us today?
I've thought about this, and I really think that as women, we need to recognize that we aren't invincible, that we have, we do get sick, we can get sick, and we need to take responsibility for the choices we make and do a better job of taking care of ourselves. I really think that we know our bodies and we know when something's changing. And if something doesn't seem right, then pay attention to that and, get some professional advice.
Thank you. Thank you. And Dr. Randolph.
Yeah, that's great advice. I just think about the fact that we as women are such advocates and caregivers for everyone else. And I hope that this section leaves people with a desire to find time to care for themselves, right? Our families are not going to be the same without us, and we are at risk for all the things that we're trying to prevent them from having. So my charge would be for us to all find 30 minutes in our days to schedule our own selves on the calendar, whether that means that we use those 30 minutes to plan out our meals so that we can have groceries already ready at home and not feel the urge to stop for fast food on the way home when we're already stressed, right? Or whether we spend 30 minutes exercising or just sort of recharging for the day. I just hope that you heard, and I'm always preaching to myself too, so many things can be treated with diet and exercise. And so if we can find time to prioritize that for ourselves, our spouses, loved ones, especially children are watching, and hopefully will do the same for themselves.
Right. Thank you. Thank you both so much. This has been just so important. Obviously, it is a topic that we need to keep front of mind, and I appreciate you giving your time and your expertise. The reality is you do it not just for this 1 hour, but you do it every day. And that's truly what I know that all of our participants appreciate. I also want to thank the participants. You have been active and thoughtful in the questions that you have asked. And I think that certainly is a wonderful indicator of not only interest, but we are in a good place to be self-advocates, as we have mentioned, and we need to keep asking those questions. So thank you for doing that. The Power of Knowing series is one that continues. And so we are already looking towards March, and we are going to be exploring practical resources for aging well. And we have 2 panelists that will be sharing both from the financial planning perspective and also from healthcare for all of us, no matter where we are age-wise and what our living situation is. And I hope that many of you will join us for this webinar. Information is already available and registration is open. So please take a moment to join us for that. And also look for the email in follow-up today. And again, if you want to submit additional questions, I will get answers. I will not answer them, I promise, but I will circle back to you. And I think that it's appropriate for us to end today's webinar with a quote from Michelle Obama. And she says, "Communities and countries and ultimately the world are only as strong as the health of their women." So I will say thank you. Thank you for joining us, and I hope everyone has a safe and good rest of their day. Thank you.